Okay, so we are going to move on, and we have the privilege of hearing from Dr. Laurie Hiemstra. Dr. Hiemstra is a clinical professor in the Faculty of Medicine at the University of Calgary, and no slouch here, also an orthopedic surgeon at Banff Sport Medicine. So she specializes in sport medicine knee ligament injuries. Her research centers on ACL reconstruction, patellofemoral instability, and enhancing surgical outcomes while preventing secondary injuries. So please join me in welcoming Dr. Hiemstra. She shares her research and tips for finding the sweet spot.
Morning, everyone. I'm really glad we had a little break there because following Lee and Matt is a little bit of a challenge. So I'll even challenging enough, I'll get my slide mover. So I want everyone to imagine, we're imagining today, that you're lying in a hospital bed and you've just had knee surgery. You worked really hard to get to this point. You followed all the instructions, you did all the physio, and you finally navigated the disaster, that's our surgical wait list, and you've had your knee surgery. You remember how it all began. It was one fateful day at Lake Louise. The sky was bluebird. The day was glorious. But in the afternoon, it got a little bit icy, and you caught an edge. You heard a pop, you felt intense pain in your knee, followed by a really, really uncomfortable ride home down the mountain in that ski patrol sled. But you wake up in recovery room, feeling a little groggy, but hopeful. You're ready to get back out onto that ski hill, get back doing all those things you wanted to do. Everything's going to be all right again, but you never want to go through this again. Fast forward, it's 3 months later. There's great snow on the hill still, and you're raring to get back on that hill. You go and see your surgeon, and your hopes are crushed. They say at least 9 months until you can get back on the slopes. You waited a whole year to get your surgery. Why should you have to wait so long to get back doing the things you love to do? What kind of things are going through your head? This is my body. I get to make all the decisions. I worked harder than most people. I should be able to do the things I want to do. I'm different than everyone else. And my favorite, that surgeon doesn't know what they're talking about. Probably sounds familiar, right? I know, because there's a couple of my patients in the audience here. So, you do what most people do. You go back skiing, right? This time, though, you go to Sunshine. That'll be way safer, not as many tourists. It's another bluebird day, and you go flying down that hill. You know you've made the right decision. But you catch an edge, you hear a pop, and you fall to a heap in the ground. With a sigh, and maybe a swear word, you pull the phone out of your pocket to call the ski patrol. Recovering from an injury or from surgery is a balancing act. Some patients think, push harder, get back faster, no pain, no gain. Other patients whisper, don't go too fast, take it nice and slow. I'm going to heal naturally. Both instincts make sense, and both come from a good place. But here's the truth. Both extremes can sabotage your recovery. If you push too hard, you risk re-injuring yourself and having setbacks. If you don't push hard enough, you can be weak or stiff and not get back to the sports you like. There's something most people don't realize. You can recover from many injuries and get back doing everything you want to do. But it's that next injury, the one that happens after your first injury, that changes the game. That's when the pathway back gets harder, when returning to sport starts to mean something different. Now, of course, preventing injuries in the first place is ideal. Wouldn't it be amazing if you never got hurt in the first place? But the truth is, if you never get injured, you're probably not doing very much, and you are definitely not having enough fun. The real key isn't just avoiding injury, but it's making sure that when you do get injured, and most of you probably will at some point, Your first injury is your last injury. Think of it like finding the sweet spot. If you play tennis or golf or baseball, you know exactly what I'm talking about. And I'm not talking about that candy store on Banff Avenue. The sweet spot is that perfect point on your racket or your bat or your golf club or your pickleball paddle where everything just clicks. You don't even feel the ball connect, but yet it goes in the exact perfect spot. That's what recovery can be like. It's about finding that balance between too much and too little, between pushing and protecting. Let's go back to you. You ponder your situation as you ride down that sled at sunshine. You sheepishly return to your surgeon. You've torn your ACL graft. And not only that, you've torn your meniscus and you've damaged your cartilage. You know what we call damaged cartilage, right? That's arthritis. So you have arthritis now, but you still want to fulfill your dreams of staying skiing, so you agree to a second surgery. You get your ACL reconstructed again, but the meniscus isn't repairable and they have to take it out. The post-op recovery isn't so easy this time. Your knee is stable, but it just doesn't feel like it used to. Fast forward 5 years. You got back to skiing, but your knee is really starting to act up over the last couple of years. It's stable, but it really hurts you all the time, and you're having trouble getting out on the ski hill. You go to see your surgeon, and you ask them to scope your knee. That's where we stick a little camera in your knee and some instruments, and we clean things up. Your friend Ralph had one done, and they got completely better, but they didn't quite have the same problem that you have. Your surgeon says a scope will not help you, and they won't do the surgery. How can surgery not help? You were in so much pain. Obviously, surgery is going to help. Why won't that surgeon listen to you? Instead, they suggest some injections. That's an injection in your knee with like a really long needle. But you have to have them every 6 months for them to work really well. And they also want you to get a big, bulky brace. This one at least is covered by your insurance company. What is going on? All you wanted was a quick scope and to have your life return back to normal so you could do everything you wanted to do again. Get on the slopes this winter. A few more years go by. Your knee is getting worse and worse. It's starting to really hurt in the middle. And your leg's starting to bow, so you feel like you go in the Calgary Stampede. Now your surgeon wants to do something. But now they don't want to do just a simple little scope so you can get back really quick. They want to actually cut your bone, straighten out your leg, and then hold it in place with screws and a plate. That's called an osteotomy. You agree because you want to ski, and that makes your symptoms better for a few years. But then you go back to your surgeon because things are getting worse again. And now they say you need a knee replacement. But now you got a whole bunch of plate and screws in your knee. So you have to have another surgery to get the plate and screws out, right? So now you're in for it for injections every 6 months, lots of physio, lots of dollars, a big brace, 4 surgeries, and you're still facing a knee replacement, and you're still having trouble skiing. For many people, maybe even most, it's that second injury that's the real turning point. The moment when everything goes sideways. You've probably heard of the term, the tipping point. And it's that critical moment where a small change or a series of small changes suddenly pushes a system past its limit, triggering something big and often something irreversible. It's like that last snowflake that made the avalanche start, or the straw that broke the camel's back. So how do we avoid that from happening? How do we stop ourselves from sliding down that slippery slope? And that is the challenge. Sometimes bad things just happen. Sometimes surgeries don't work perfectly. But how do we minimize the chance for that second injury? You're waiting for this answer, right? It's actually really, really simple. Ready? Listen to your surgeon. So I know what you might be thinking. Of course I would say that. Of course I would. But hear me out. How do we know as surgeons, how do we know when an injury really needs surgery? And how do we know which surgery to do? How do we decide how much rehabilitation you need? And how do we know when you're safe to go back to sport? How do we figure out how to prevent that second life-changing injury and make your first injury your last injury? Believe it or not, surgeons don't just flip a coin to see who gets surgery. We don't only operate on people we like, which is probably true, yeah. We're not just sitting around figuring out ways to keep you off the playing field or off the ski hill. Believe it or not, most surgeons would actually be very happy never to see any of you ever again, at least as our patient. But everything we recommend, every protocol, every timeline, every exercise is grounded in science. We call it clinical research. It's the kind of research that directly shapes how we treat injuries, how we guide recovery, and how we help you get back doing all the things you wanted to do, safely, confidently, and long-term. Now, I just want to change your perspective just a little bit. Let's imagine that you are me. Welcome to the mind of a surgeon. It's actually not that neat, usually. It's a little messier. So when you first walked into my office, I didn't just see a patient. I saw a puzzle, something to figure out. So when you told me your story about how you got hurt and how your knee was feeling, I knew, based on evidence, that an ACL reconstruction would be the best operation to give you a stable knee, to return you to all the things you wanted to do, to prevent a second injury, and to protect your knee from getting arthritis as you got older. How did I know that? Well, let me tell you about some research studies we're doing. This is the stability study. This is a multi-center, so lots of centers, international, lots of countries, trial, and it included both the University of Calgary and Banff Sport Medicine. This study taught us that in high-risk patients, if we add a little step to our ACL reconstruction called an LET, which is a lateral extra-articular tenodesis, you can see why we use acronyms a lot, right? So if we add that step to your surgery, it actually reduces the chance of you tearing your graft. So as we take a little piece of the outside muscle of your knee and we reroute it and reattach it, it's a little like if your ACL was a belt and we added some suspenders. So we know from this study, if you're high risk and we add that little extra procedure, we reduce the risk of your graft rupturing by 60%. And we also know that if you delay returning to your sport, every month that you delay that, it reduces the chance of that graft rupturing by 14%. If you're not high risk, if you're normal, moderate or low risk, the LET doesn't change your outcome at all. So why would you add any extra surgery? So when you came into my office, I knew that you were a perfect candidate for an ACL reconstruction. The best graft for you would be a hamstring tendon, and you didn't need to add the extra LET. There's more. In Banff Sport Medicine, we're doing a delay OA study, and you can imagine what that one's about. But we're investigating how, when you have your ACL reconstruction, if your cartilage is perfect and your meniscus isn't torn, the chance of you developing arthritis down the road is very, very low. So when I came into your room after you had your surgery, and I said, you know what, the surgery went great. You had no cartilage damage, your meniscus was fine, you're going to do really, really well. I was actually speaking from decades of research. I wasn't just trying to make you feel good. Research also lets me tell you the risks of having surgery or the risks and benefits of not having surgery and treating your knee with rehabilitation. Because of studies that I've done here at U of C, I could tell you that it was safe for me to send you home the same day as surgery. You didn't need to stay in the hospital overnight. And this is what evidence-based surgery looks like. We're not just guessing. It's the culmination of years of science, carefully applied to you. After your surgery was over, the journey isn't done. Research from Winnipeg has shown us exactly when it's safe to start more aggressive strength training, like plyos and box jumps. Other clinical studies help shape the rehabilitation programs that you and your physiotherapist followed perfectly, right? So that you could safely return your strength and get back to your sport. And what about returning to sport? Research tells us that the biggest barrier is actually not your knee, it's your mind. Fear of re-injury is a key factor in whether patients get back doing the sports they love. So in my case, I have a whole bunch of patients that need a whole bunch more fear, and I have a whole bunch of patients that could get rid of a whole bunch of fear. The truth is some patients have a lot of difficulty returning back to the sport where they first injured their knee. And it's my job as their surgeon to give them some tough love sometimes to steer them back towards that sweet spot in their recovery. Later, when you came to my office, when your knee started wearing out and things seemed to be going downhill, decades of Canadian research have given us clear answers. This study in the New England Journal of Medicine, which is medicine's top journal, this study was done in London, Ontario. We actually did this study when I was training as a fellow, which was a couple of years ago. But that study showed us that scoping a knee for arthritis rarely works, which is why your surgeon wouldn't offer you a scope. But this study became world famous and has directed many of the guidelines around the world, including our Canadian guidelines, which tell us when it is a good idea to scope the knee, and arthritis isn't the top of that list. We know that procedure to straighten your knee, that one you had, the osteotomy, we know that delays a knee replacement by an average of 9.5 years. That was research also done in London by Canadians. And we know exactly when we've reached the limit of what we can do for you, and that a knee replacement really is the only option, whether or not that's what you wanted to hear. Science guides every step, from your first injury to when we make the decision to you need a knee replacement. And while every patient's journey is unique, research gives us a roadmap, a way to make the path clear towards us clearer, safer, and smarter. So we're going to fast forward to the present. Since you're now recovering from your knee replacement, you have time to come to the Wood Forum and listen to us all talk. And you do understand the importance of finding the sweet spot in your recovery. And you know that clinical research informs everything we do for patient care and what your surgeons are telling you. So we can tell our opening story with a little better ending. We can get in our DeLorean time machine back to that first 3-month visit you had with your surgeon. This time, you listen to your surgeon, who clearly has your best interests at heart. You get back into the gym and you maximize your rehab. You take the year off skiing so that you can return to skiing with full strength, coordination, and confidence. The next year, you ski like you were made for it, and you do so for the next 25 years with no further injuries and no further surgeries. Congratulations, you have successfully made your first injury your last injury. Thank you.
Thank you so much to Dr. Hiemstra. I've recently been in and out of some surgeons' offices, and I can see why when I brought my ChatGPT explanation to them, they were not having it. We should trust science, and thank you for absolutely underlining that importance.